For nearly 2 years, West Australians have been told they're the envy of the world, living a restriction-free life with only a handful of days spent in lockdown. February 5 was to be the day the state reconnected with the rest of the country and the world.
This state is locked in, barring some unforeseen emergency or catastrophe, which we can't predict.
Next, please.
The Premier argues Omicron, a highly infectious but largely milder variant of coronavirus, has changed everything. He wants people to be boosted with a third shot of the vaccine before opening up.
It would be reckless and irresponsible to open up now. I can't do it.
The perpetual uncertainty is proving challenging for Sydney-based Crystal de Grusa and her family, who've been denied exemptions 3 times since WA closed its border.
It's been 2 Christmases now, multiple celebrations that we've missed, multiple milestones of my daughter that my family have missed, and I'm incredibly terrified to think that it may be another Christmas. With young children, it takes an absolute village to raise them, and my village is in Perth and my heart is in Perth, and I haven't had that opportunity to see them in such a long time.
Crystal's hopeful she and 3-year-old Quinn will be eligible to quarantine for 14 days under new, vaguely worded exemption criteria. But her personal trainer husband, Radic, who runs his own business, can't work from home.
Many people don't have 4 weeks of annual leave and 2 weeks to just sit in a house or in hotel quarantine. There's so many blue-collar workers, and I think it's incredibly elitist to assume that everyone can have that option.
Omicron is already circulating in the community in WA. The state's chief health officer has advised borders should be opened when WA reaches a certain number of local cases, but hasn't said what that number would be. Emergency doctor Peter Arlely is the WA chair of the Australasian College for Emergency Medicine. He says there are dozens of doctors who are counting on arriving in WA after February 5 who will now need to quarantine. He's concerned they won't end up coming.
There's a lot that were due to arrive in December and January that delayed it until February. And now they are left in limbo, and we need to give them some certainty. Otherwise, they're going to work somewhere else, I'd imagine. I know I would certainly consider it.
The problems in the WA health system, despite having few COVID cases, have been widely publicised, including ambulances spending record amounts of time offloading patients and nurses publicly rallying during the past year. But Dr. Arlely says he and his colleagues are as ready as they will ever be, and any delay should be a matter of weeks, not months.
We want to be in the sweet spot where we've still got fairly good immunity from our 2nd dose and 3rd dose vaccinations. And if we wait too long, we'll be in the middle of winter, which would be the worst possible time to open up, I feel.
WA Health didn't respond to questions by deadline. Premier Mark McGowan has enjoyed unprecedented levels of popularity by sticking with his hardline approach to COVID. His policy hasn't changed much since 7:30 asked him about vaccines almost a year ago. As Australians are vaccinated though, do you accept that the way you manage COVID-19 in the state will need to change because the risk factors have invariably changed?
Well, that's something we'll determine in the future. But this pandemic or future pandemics, slowing down movement has been effective in stopping the spread of the virus.
Your tolerance. You won't be dropping your zero tolerance approach for cases then?
Well, we have a very cautious approach, and caution has worked.
With Mark McGowan, I think he has done a really good job. Obviously, yes, we are going to have to open at some point. So, when that will be, is up to him. He actually comes in here a bit.
That the Premier is still waiting and watching what happens in other states and territories comes as a relief to some. Fremantle cafe owner Mel Jorgensen doesn't want the border to open yet.
My reaction was one of relief, I think, with just seeing what's happening over in the eastern states at the moment. I'm really glad that he has kept the borders closed. just if Omicron comes over here, the way that it has over east, it would mean obviously closing our business, maybe if one of our staff got it, or if we become an exposure site. So I'm kind of relieved in a way, because it means I get to keep my job, it means I get to keep working.
In relation to Western Australia, that's very much a matter for the Western Australian government.
State premiers have made decisions based upon health advice.
Obviously, we'd like to see borders come down right across the country and to see us united as one, but this is a decision that the Western Australian government has made.
With a federal election on the horizon, there's real pain behind the politics.
My father is high risk, so there's no way that I was going to come in February and, in the words of Mark McGowan, just let the virus rip. We've done everything that we've been asked to do to get in to see our family. All of our fellow West Australians have done the same thing in Western Australia. And as far as we're concerned at this point, the only person that's gone back on his word is Mark McGowan.
Opening at the worldwide peak of Omicron would lead to a very, very rapid incursion of COVID into WA. So we can understand some of the reasoning behind the government's decision. But one thing that healthcare workers are really calling out for is certainty, because we've been working frantically behind the scenes, getting ourselves ready for the 5th of February. And now we've been left in limbo and we're uncertain.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.